Alright, my name is Dr. Ntuk Monde Robert, Medical Director of Bethphage Medical Center, located in Maryland here in Lagos. LinkHMS has helped us a lot, where it has made it more productive and it has made work easier for us. At a glance, you can see summary of what you have done for the patient. Well, in the past we tried using one, but it was not palatable. We had to stop. Well, when you are taking history, there is this feature there. Instead of you typing, you just say what you want to be written down and to be taken, and the computer, the AI, will just write it down for you. We don't have to be following patient. Let me take you to the lab. Let me take you to the, just tell the patient. The next thing is to go to the lab. The lab person already sees what you have, the test you have recommended for the patient. So we don't need an extra hand to be taking patients about. And once he finishes with the lab, goes to the nurses for the prescription. It is already there. And like before, when patient come, we have to collect card number, go and start searching for the card, and then you start flipping pages of the card to check the history. But with LinkHMS, once the patient comes in, we just slot in the name, everything prop up, and then you are good to go. It makes the work easier for us. It's about 3 months now we sign up with LinkHMS. Well, so far so good. The experience, I would say, has been good. And at least for now, we don't have any regrets. Just some little itches. When it occurs, we call them and quickly they will rectify it or send somebody down here within 24 hours. Well, I will encourage other hospitals to join. And my final words for LinkHMS is always listen to the doctors who are using the app, so that they will help you upgrade better.
My name is Mrs. Ntuk. I'm the matron of Bethphage Medical Center here in Mende, Maryland, Lagos State. Okay, my experience so far with LinkHMS, so far so good. As a nurse working in the nursing department, especially when taking vital signs, we give our patients confidence, believing in us that we are doing a good job. So it's a good experience. Generally, before LinkHMS, we normally have issue because some patients will come to the hospital and we keep on searching for their card, but now nothing like that. When they come, we just lock in their names and it pop up. We continue with the vitals. So it's very easy compare when we are using the manual, the card. It's very easy. You just lock in and you continue where you stop. And even when handing over, the nurse coming to take over will see the work. You don't need to start looking for it. So it's good one. What I like most is the time. There is no time wasting. No time wasting. You know, at times when patient comes to the hospital, some of them, they don't even have history. They will tell you, I've registered. Asking, I have a card here with you. Unlike before, they will try to prove you wrong. But now, nothing like that. Okay, I will recommend LinkHMS to other hospitals. They should give a try. It's a good one. They should give a try. They will testify about it.
Hello, good morning. My name is Oluwatosin Daniels, the lab technologist at Bethphage Medical Center. I would like to talk a little bit about, I would like to say one or two things about the LinkHMS. Prior to using the LinkHMS, we've been having issues with sending out results, and then the stress of going to doctor's consultation room, it's quite stressful anyway. and then releasing results. Sometimes we have issues with getting to know the type of test patient wants to run. So we have to start asking from one nurses to the other, and the nurse that will be on duty might not really be on duty the next day. The nurse on duty last night might not be on duty. So there's a lot of confusion. But now that we have the LinkHMS, it's quite easy for us to get to know what test the patient needs to do without even having to ask from a particular nurse or even from the doctor. And then when the result is ready, it goes straight to the doctor. I don't have to start standing up to go to the consulting room to see the doctor for the result. So it's comfortable for me and easy, very, very easy.